Hey guys, welcome back to my channel. Today we're going to talk about injuries and how you can use nutrition to help speed up your recovery. Before we get into it, please don't forget to subscribe to my channel and also hit the notification bell so you don't miss any of my future videos. Injuries can happen to anyone, whether you're a weekend warrior or an elite level athlete. It can really derail your training schedule. And to top it off, an unexpected and slow recovery can be even more defeating. You could be doing all of your rehab exercises to a T, but you still feel like you're stuck in slow motion. And then one day you wake up and your knee or your shoulder finally feels like it's healing properly and you can go back into training, but then some sort of misstep or movement lands you back onto the bench in pain, wondering why your healing process is taking so long. It's pretty disheartening seeing your friends and teammates improving and progressing well every single session when you're stuck, unable to train because you're in pain. The truth is your body could be missing one crucial piece of the puzzle: your nutrition. Injuries cause damages to your muscles, tendons, and bones, and to rebuild and strengthen these, they require vital resources. Amino acids help to form collagen, vitamin C helps to rebuild your tissue structure, and zinc helps to strengthen your immune function. The persistent pain, delayed healing, and repeated setbacks is often due to missing nutrition. So, if you're not getting enough of these nutrients or overall food, then your body has limited supply to support your injury and get you back into training. But the good news is I've got a few tips to give you that you can start today and help speed up your recovery. The first one is that during injury, it's important to stick to your maintenance calories so that you maintain your weight during your recovery. Now, while it's really motivating to start dropping into a calorie deficit, start to shift some body fat, it can be really detrimental to your recovery as you are at risk of losing some muscle mass, increasing inflammation, and prolonging your time back into training. So to figure out your maintenance calories, use this formula if you're a female or this formula if you're a male. Plug in your age, height, and body weight to figure out your basal metabolic rate. Next, you want to multiply this answer by an activity factor that's most relevant to your movement throughout your injury. This will then give you a good baseline of calories to start with that you can then increase or decrease depending on the trajectory of your weight. The second step is making sure you're getting enough protein in across your day. Protein is an essential framework to rebuilding your muscles and tissues after damage. And research shows that during injury, your body's requirements for amino acids are elevated, particularly because of collagen production. So to make sure you're having enough protein during injury, reach 2.2 to 2.7 grams of protein per kilo of body weight. You can also pair this with a collagen supplement of 20 grams of hydrolyzed collagen peptides throughout injuries so that you're getting enough collagen to your injured tissue. And the third tip is to make sure you're prioritizing vitamin C and zinc-rich foods. Citrus fruits are an excellent source of vitamin C, which plays a crucial role in the biochemical processes that support healthy collagen fibers and healthy tissue production. And foods like lean meats, seeds, and shellfish are high in zinc, which are supportive for your immune function as well as tissue repair. So just to summarize, you want to make sure that you're reaching your maintenance calories, you're having a higher protein diet than usual, you're supplementing with collagen if necessary, and you're prioritizing vitamin C and zinc in your diet. Even by following these 4 tips, there are some mistakes that you should be aware of so you avoid making them. Number 1 is overestimating the energy drop in your maintenance calories. So your new maintenance calories is going to be slightly lower than your previous maintenance because of the difference in training load. However, your energy output is much less than you think. So my tip is to make sure you use a formula and don't just guesstimate your new calorie or new maintenance amounts that you should be sticking to. Follow the formula, reassess your new activity factor, and then reassess from there. The second mistake is miscalculating your protein intake. Athletes generally reach a high protein diet of around 2 grams per kilo of body weight. However, when you're injured, these protein requirements increase. So to make sure that you're getting in enough protein, I suggest tracking your food over a couple of days, whether that's through a nutrition app or writing down your protein intake. Then you can see how much you're reaching and know whether you need to adjust from there. Third mistake is overlooking micronutrients. I spoke heavily about zinc and vitamin C, but your other vitamins and minerals are just as important to help decrease inflammation and support your overall health. So make sure that you're prioritizing an array of different colors of fruits and vegetables in every single one of your meals. The fourth mistake is not a nutrition one, but it is very relevant in the injury space, and that is rushing your rehab. It's really tempting to go full throttle as soon as you start feeling better, but the reality is you can easily re-aggravate your injury if you push too hard too soon. Think of it like a scab that is not fully healed yet. If you start picking at the scab, it's going to prolong the recovery process and also cause a scar. Next is neglecting your rest and sleep. If you are not getting enough sleep, it doesn't matter how good your nutrition is. You are not getting the restorative deep sleep that your muscles and tissues need for repair. So ensure you're getting at least 8 to 9 hours of sleep every single night. And the last mistake is stopping your nutrition support way too soon. Even after you are out of pain, your muscles, bones, and tendons still continue to strengthen over weeks and months, and they require your high protein diet, vitamins and minerals, and extra calories to help support this process. So if you've been battling with constant aches, reoccurring injuries, and slow recovery, I really hope this video was helpful for you. Please don't forget to like it and subscribe so that you see all of my other videos. See you next time.